Hello friends, welcome back to the Crack Nursing Licensure Exam channel. So the previous videos we have been discussing regarding the test taking strategies. So previously I have been uploaded the two videos as a part 1 and part 2. So the points with the pyramid point and ingredients of question, strategic word, subject of question, positive and negative and query, using of ABC method and using of Maslow's hierarchy needs. So these are all the some of the strategies they will be using while they are been taking an exam, while they are been making a question, while they are been framing the questions. So they will be using these strategies. And today we are going to see in this third part of video regarding the nursing process. We are going to deal with the nursing process like assessment and analyzations, and with the diagnosis, and with the planning and intervention, even with the evaluation. So in those steps we are going to discuss. So in the previous video we have been discussed all these strategies, the previous strategies. If you want to go through that, you can I'll be giving the link below with the part 1 and part 2 videos, so you can view those strategies in that videos. So today we are going to see with the nursing process. So the first step of nursing process, you will be making an assessment. So while you are making an assessment with your patient, so based upon that they can ask you some questions as your been assessment step. Based upon your assessment and with the examination base, they will be making an questions regarding that. Example, we have one example here, you can understand with this. A client who had an application of a right arm cast. He is having a complaint of pain at the wrist area when the arm has been passively moved after applying the cast. Which action should the nurse will take first? So what we have to do here, whether you will elevate the arm or document the findings or medicate with an additional dose of an opioid or check for the paresthesias and paralysis of the right arm. So among this, which would be the first priority thing? That means which would be the correct way of making the first step of assessment here with this patient. So the correct answer, whenever you are going with the right arm cast, not only here with any type of cast application, so there are few warning signs we have to check for. Whenever you are going with the applying the cast, because they may get increased in pain and feeling of like more pain in that splint areas with the cast areas, that may be because of too tightness of the cast application. That may be the reasons to cause it. So even because of the too tightness, that will be causing a swelling in that part. So as reason behind that, they will be having a pain and they will be having a feeling of pain more. And even the numbness and tinglings also will be there in the hands and feet where after applying the cast. That is also because of too much of pressure over that part area, like in that nerves. So even with the burning and stinging sensations also, like that is also because of too much of over pressure on that particular area after applying the cast. That is also another one problem can create it. And even with excessive swelling also below the cast will be there. This may also means the cast has been slowing the blood circulation because of the too much of pressure. Excessive swelling also you can see. And like loss of active movement also, as we have seen in this previous question, no? So like paresthesias and paralysis may be the problem that can happen as a result of this over compression and over improper application with the too much of pressure over that part as a result of cast. So these are all the warning signs that we should follow, we should observe for the patients. We should observe the patient after applying a cast and splint. So here the correct answer will be, we need to check for the paresthesia and paralysis is the right answer. So whenever you have been applying with the cast, that may be too much of tightness, too much of pressure would be. So because of too much of compression would be. That means so we must go with the paresthesia. We need to check for paresthesia and paralyzations of that right arm, because he would be having a pain because of this over tightness and over pressure. So we have to check for this thing. So usually you must know the differences between paresthesias and paralysis. That you know the paresthesia means that is called numbness and weaknesses over a particular part. because of a nerve compression. Paralysis, that is a loss of muscle function. As a result of the nerve dysfunction, as a result of compression, too much of overpressure, the nerve compression will be leaded to the final nerve dysfunctions at last. So the complete nerve innervation will not be there in that particular part. So as a result of that, the muscle functions will be getting lost in that part. That is called a paralysis. So this is like this way the questions can be asked based upon assessment type. So next with the analyzation type. Analyzation step means that is like with this strategy, nursing process with analyzation method. So one of the example is been given here. So like based upon the laboratory result they can ask you, and with the they'll be giving you some laboratory results and with the lab results and with the reports. So they'll be giving those analyzations and they'll be asking you to analyze the condition, what it would be mean. So we need to diagnose the condition. That is our responsibility to do so with this type of questions. So the nurse has been reviewing the arterial blood gas results of a client, and he have been noting that the following pH as a 7.45, PCO2 is 30 mmHg, HCO3 is 22 milliequivalent, and the nurse has been analyzing these results as indicating which condition they are asking you. Usually whenever you are making an ABG analyzation, you will be needed three important things, that is the pH and PCO2 and with the HCO3. So they have given all these three here, and you have to analyze the answer, which would be the condition. They have given four options, that is the metabolic acidosis compensated, and with the respiratory alkalosis compensated, metabolic alkalosis uncompensated, and with the respiratory acidosis uncompensated. So you must note down the normal levels with the pH and with the PCO2 and with the HCO3. Only then you can able to analyze the conditions here. So normally we must know the tabular column. Actually the correct answer is a respiratory alkalosis compensated. How you can say this means? So actually the pH should be maintained between 7.35 to 7.45. If it goes below 7.35, it is been like acidic in state. That shows that acidosis happens here. If it's been above 7.45, that has been going into the alkalosis condition. So you can say that he's been going into the base state, so that is he is undergoing alkalosis. Even with the PCO2 also, you must know the normal value 35 to 45 is the normal. So whenever if it goes below 35, it always goes below during the time of like alkalosis. So if it goes beyond 45, it will be always goes beyond the 45 during the time of acidosis condition. And HCO3 is also like bicarbonate, 22 to 26 is the normal value. If it goes below 22, it always will be denoting that is acidosis condition, and if it goes above 26, that is been indicating the patient has been undergoing alkalosis. Even the two things we must know. So with the respiratory and with the metabolic. So whenever if there is any problem happens with the respiratory system, like with the respiration, something like carbon dioxide over accumulation, or if there is a more deficit if it happens with the carbon dioxide, and like hyperventilation type of conditions. So the deviations you can see here with as a result of a respiratory conditions. So you will be getting problem with your CO2 level, and even with the alkalosis and acidosis happens here based upon that conditions. So next with the metabolic type of problem, usually the metabolic problems happens here with the renal functions, with the pancreas and with the renal functions. With that, if there is any problem happens here in this system, you will be getting a problem in this metabolic status will be getting altered here. So your bicarbonate level will be getting altered. So that will be responsible here to make the metabolic condition. So here with this question you can see the abnormal value that is being seen with the CO2, that shows that respiratory is been getting affected here. So like a CO2 is 30 mmHg. With that itself you can decide it that is a respiratory, but HCO3 is within the normal range. But you have to look it for the acidosis or alkalosis. You have to see for the pH level. It has been going towards the alkalosis. It was been lying on the side of alkalosis. So that means like at the edge of alkalosis end. So you can say that is a result of alkalosis. Even this type of his CO2 level will be getting always lowered, means that will be always lowered during the time of alkalosis. That is also one more thing you can confirm here with this condition. And one more thing is that compensated or uncompensated. So with this things itself you can analyze the second one as a correct option here. But with the compensated type, here the HCO3 is been getting into the normal only. That shows that he is been already compensated. Compensation was been completed. So that shows that here there is nothing more to compensate here. So he has been already compensated. So that is the indication here. So in a future, I'll be trying to take a class on ABG alone, like acid-base balance imbalances conditions also. So I will be taking the classes in the future videos. I will be trying to post it. So next one step with the nursing process is the planning step. So in the planning, usually whenever there is any complaints, if there is any problem happens with the patient, we'll be planning according to their problem. So we'll be planning as a priority wise also. That is also very important one, which you have to do at first, which you have to do at second. We must know to do. So the one of the example is being given here. You can able to understand with this. So the nurse is developing a plan of care for the client with the cataract. You have been understanding that which problem will be the priority thing you have to take into your account, and you have to make a plan according to it. Which would be the priority problem will be here with this cataract patient. First one, a concern about the loss of eyesight. Second one is the altered vision due to opacity of the ocular lens. Third one, difficulty in moving around because of the need for glasses. Fourth one, becoming lonely because of decreased in community immersion. So among these four, which would be the most priority problem happens here? Usually the cataract is the mainly with the opacity of lens. So the vision usually altered here. So that would be the correct answer. The second option would be the correct answer. So the basic first priority. So because of this opacity of the lens, he will be not able to have the proper vision. So that would be the correct answer to be answered here. So according to that, we have to make a plan. So when we are going with the interventions with this type of cataract patients, we have to assess the patient's degree of their visual impairment, and we need to ensure the proper environment around them, like room environment with a safe and adequate lighting sources, and with the furnitures should be in a proper places, and remove all the rugs from the even with the objects that has been being as obstacles and hazardous for them in between their ways of walking, and keep the patient's glasses and call bell also should be within their reachable, and instruct the parents and with the families or with the patient and families regarding the need for them to maintain a safe environment for them. Instruct the patient and with the family also regarding the safe lighting sources will be needed here. And even the patient should wear the sunglasses also to reduce the glares when they go out, and advise the family to use the contrasting bright lights in the household furnishings also. So these are all the basic things. You have to make a plan according to this altered vision problem. So next we are going to see with the nursing process implementation step. So with this implementation, when you are making a plan of care, you will be implementing line by line. As a priority wise, you will be making a plan. So with that plan, you will be implementing those things, those points in a priority wise. So as an example, the nurse is caring for a hospitalized client with angina pectoris who begins to experience a chest pain. The nurse is administering a nitroglycerin tablet here. Sublingually, you have been administering as a first dose of drug, but the pain has been unrelieved. But the nurse should take which action the next? Even after administering the first dose of nitroglycerin, his pain was not subsided. What you will be doing at the next? First option, whether you will reposition the client or call the client's family. Third one, whether you will contact the doctor, or fourth one, whether you will administer another nitroglycerin tablet here. So you must know the universal principles. That means like a principle which is been with the protocols and the guidelines which is been given here to administer the nitroglycerin, we must know. So according to our American Nurses Association, and even with the some of the associations also, so with the cardiac associations, with the cardiology, so we can use usually whenever you are been administering as a emergency, as a first aid, as an emergency you will be administering the nitroglycerin for the chest pain. So we have one more thing here we must know. That means whenever you have been administering the nitroglycerin, we have a guidelines to be used like 3 times the drug can be used. That means in a first dose, if you have been administering the nitroglycerin, the pain was not subsided even after the 5 minutes also, means you can go with a second dose of nitroglycerin, and you can wait for another 5 minutes. Even though if the pain is not subsided, you can go with a third dose of nitroglycerin also. But with after the third dose, even though the pain was not subsided even after the 5 minutes after the third dose, means you should not continue with the next dose. We have to go with the doctor's advices immediately. So this was one of the guidelines you can follow. So as an emergency drug management. So you no need to wait for your doctor's advices for the first dose of till the 3 doses. That means the first 3 doses can be administered by the nurse itself. So you will be having a proper guidelines and protocols according to your hospitalized with your hospital organizations. You have to ask and you have to follow this. So each and every hospital, even each and every state wise, they will be having a guidelines. They will be following to them. According to this guidelines, whether we can follow this or not, you have to ensure that and you can go with this guidelines. So this is like 3 doses of nitroglycerins can be administered actually. So by every 5 minutes once of time, like every 5 minutes once of interval time, you can take that. So up to 3 doses of nitroglycerins can be administered. So like sublingually you will be administering it. So that is one of the thing you will be having here. So we can, the next step with this question is that we have to administer another 1 dose of nitroglycerin. Finally, with the nursing process is the evaluation. So even with the evaluation, they will be giving some situation with the patient's condition, even with the treatment processes, with the effectiveness of the treatment, or with the what was the benefit was and what was the condition he was being got into after the treatment. So they will be giving you some situation type of questions like clinical exam, with the clinical practical questions they will be giving you. And you have to analyze that whether the patient is being in a very good condition or whether his condition is being like degrading, or whether it is whether they got a beneficial with this treatment or not. We have to decide it. So that is like evaluation step based questions. So that is also one of the strategy they will be using while they are making a question. Example: the nurse is evaluating the client's response to the treatment of pleural effusion with a chest tube. The nurse is noting the respiratory rate as a 20 breaths per minute. You can see the fluctuation of the fluid levels also in the water seal chamber. A decrease in the amount of drainages also is there, like by 30 ml since the previous shift. Based on this information, which interpretation should the nurse will take here? Whether the client is been responding to well to your treatment, or suction should be decreased to the system, or the system should be assessed for an air leakage, or water should be added to the water seal chamber. We must look into the question first. So they have given respiratory rate as 20 breaths per minute. That is also within the normal range of the person's respiratory rate only. And actually the fluctuations they have given here in the fluid level of the water seal chamber. Actually that is a normal or abnormal, we must know. Whenever you are seeing the water seal chamber, the fluctuations will be there, like up and down, like oscillation movement will be there. Even with the decreases in the amount of drainages also they have given here. In the previous shift, the previous nurse has got 30 ml, but in your shift that has been very low than the 30 ml. Actually the decreasing in the amount of drainages is also a very good sign of the patient improvement. You should not get a increased in your drainages level with the previous shift. Always you have to get a decrease in your drainages level. That is the correct way of your treatment, effectiveness of your treatment. And based upon this interpretation, we can say that client has been responding well to the treatment. So this is the correct answer. So whenever you are making with this type of evaluation steps questions, we have to identify that whether it is a normal or whether it is abnormal result. We need to check for those things. So that is a type they will be asking you in evaluation. So today that's all with this class. So from the next class, in the next part of our class, I will be taking the remaining strategies. So with this class, I will be giving in the description the part 1 and part 2, which I have been taken the previous strategies. So you can go through that once, and this is the third part, and following with this, I will be taking you the remaining strategies in the fourth part, which is going to be in the future. So please like to my channel, and please subscribe to my channel, and please like this video, and you will be getting more videos updated in a near future. Thank you. All the best for your examination. Crack well your nursing licensure examination. Bye.